Welcome to another episode of Wild and Well. Today I'm joined by dentist Dr. Katie Lee to talk about the oral microbiome and so much more about our dental health and how we can support our kids and ourselves to have optimal dental health. Welcome, Dr. Katie. Thank you so much for coming on the podcast. But before we get into all of that, can you tell us one thing that you did today to take care of yourself?
Yes, I woke up early, got out of bed when my alarm went off, and I went for a wonderful 30-minute power walk slash hike with a weighted vest on. And then I did about 10 minutes of stretching. And that is incredible for me to be able to do that for myself. So that started my day just right.
That's a really great way to start. I've been
Yeah.
hearing a lot about these weighted vests, and I'm thinking it's a good idea.
I have a 2-year-old son and his sleep is really intermittent. And so I try and get up early most days, but when I go and try and work out, sometimes he'll wake up 10 or 15 minutes after I try and start my workout. So I don't get my workout in. But yesterday and today, actually 2 days in a row, I got it in.
Amazing. Yeah, those are good days. So before we really get into things, can you share a little bit about you and what it is that you do?
Sure. So I am a biological and functional dentist, which just means I'm a regular dentist. I just do procedures and things that make people healthier. So I use materials that are biocompatible with patients, but most importantly, I do a lot of salivary microbiome and inflammatory testing to see what are the root causes of people's oral health issues. And then I integrate a team of providers and we all work together to help patients achieve their optimum health.
And how was it that you got into dentistry?
So when I was 14, I was riding on a four-wheeler and I had no helmet on. And I crashed into a telephone pole head first, going about 35 miles an hour. And I broke every bone in my face from my eyebrows down. And I was in a coma for about 5 days. Obviously, I lost and broke a bunch of teeth. And the doctors that night wired my jaw shut. And for the next 8 weeks, with my wires on, I survived off of ice cream, box mashed potatoes, Slim Fast, Jello, putting all the things you should never eat. That's what I survived off of. And so naturally, I became very emaciated and malnourished, and my liver enzymes started spiking and my kidneys started shutting down. And so I learned at a young age just how important your mouth is to your overall health. And once I got my wires off, unfortunately, my jaw had fused completely shut. So I still couldn't open my mouth. And it took 4 years and 9 reconstructive surgeries for me to be able to open my mouth enough to fix all my broken teeth that were now decayed and rotted and infected. But more importantly, also to replace the front teeth that I had lost in the accident. And so there was a big physical component to what I went through, but then also a big emotional and mental component to being a high school girl without any front teeth, right? And so I remember my senior year, once I got the last surgery, was they took my rib out, removed my jaw, transported my rib bone into my jaw so I could finally open my mouth. And then I got my teeth fixed and my smile replaced. And immediately after the infection was out of my mouth, I mean, I immediately felt better. But then when I got my smile back, everything clicked. And I said, this is what I got to do for people. So that led me into dentistry.
Wow, that's quite the story and quite the
Yeah.
motivation. I remember I read your book, Saved by the Mouth, and
Yeah.
just reading that story, I was just, oh, shocked. I never want my kids to go on one of those quad bikes.
I know, and I grew up riding those and I had two accidents. One, I had my friend ran over my foot and I broke my foot in fifth grade by one. And then my big accident later when I was going into high school. So yeah, they're quite dangerous.
Yeah, definitely. So, can we get into the microbiome? Most people have heard of the gut microbiome by now, but a lot of us have not heard much about the oral microbiome. Can you tell us what it is and why it is something that we should care about?
I would love to talk about this. So we have, the gut microbiome is basically everything that brings together the bacteria, the viruses, the protozoa, all kind of the microbes in the mouth. That's the oral microbiome. It's the second largest microbiome in the body, second to the gut. But why it's so important is the mouth is the largest entry point into the body. And the mouth is oral microbiome is what seeds the gut microbiome. So if you think about it, we have all this bacteria floating around in our gut, which we need. The gut microbiome is responsible for 70% of our immune system. But if we pause for a second and think, well, how did the microbiome actually get to the gut? Well, one of the major ways is through the mouth. So we are swallowing over 1 billion bacteria a day. And many people often forget that the mouth is the start to the digestive system. And so you cannot have a healthy gut microbiome without a healthy mouth oral microbiome. And so that's really what I specialize in on my practice.
Yeah, it makes sense. It's all connected, isn't it? Obviously,
Yeah.
one is going to affect the other.
Yeah. We actually see a lot of in dentistry before, because a lot of dentists aren't really that well versed in the oral microbiome. Unfortunately, it's not something that we know there's bacteria in the mouth, but we really don't study the intricacies of the oral microbiome and how it affects systemic disease. But what we know is that when the oral microbiome is in dysbiosis, which happens very frequently, and it's very subject to our environment and our diet and our stress levels, that will cause acute inflammation in the mouth and trigger the breakdown of our gum tissue. And the gum tissue is where our bloodstream is. That's why a lot of times people's gums are bleeding. It's because their gums are being broken down by inflammation. And once the gums are bleeding, that means that bacteria are getting from the mouth into the bloodstream. And now those bacteria can circulate to all different areas of the body and take up residence where they shouldn't be and cause systemic disease.
Yeah, such a common concern, isn't it? Like so
Yeah.
many people talk about how their gums bleed when they floss, and it seems almost like it's normalized.
It really, when I started practicing back in 2010, I would hear all the time from patients, my gums bleed, but they've always bled. It's not something to be concerned of, or everyone in my family's gums bleed. I do think awareness is starting to come around though. There's some commercials out there now by Crest and Colgate talking about bleeding gums and how that's not normal. But they really don't go into anything else besides it's not normal, go see your dentist. But I'm even thankful for that. But I do think a lot of patients specifically are starting to pay attention to their overall health and well-being. And it doesn't make sense for a portion of your body to spontaneously bleed, right? Like if your skin started bleeding out of nowhere, you'd be very concerned about it. And so bleeding gums isn't normal. I think people are starting to realize that.
And what is it that disrupts our oral microbiome? What are the main, I imagine there's lots of things that impact it, but what are some of the main things that are causing that
Yeah.
dysbiosis?
Yeah, so lots of things can contribute to dysbiosis, but some main things are going to be our diet. Our diet is super impactful to what microbes flourish. The old saying is you are what you eat, and that is so true for your gut, but also for your mouth. The bacteria that cause a lot of issues in the mouth and the rest of the body actually love to feed off of sugar. So it's the same thing in the gut, right? Yeast loves sugar, bad microbes love sugar. Same thing applies to the mouth. So a diet that is high in sugar and processed carbohydrates is going to cause a dysbiosis. Another big thing is going to be the environment. So when I say environment, I'm talking about, kind of where you're living, what you're doing, if you're traveling, but also who you're surrounding yourself with. So the microbiome is definitely contagious. And so if you live with someone or you're close by with someone who has a dysbiosis, chances are you're going to pick up that bacteria. And we see that when we test families. Families have a very similar microbiome profile. So those two things are the primary causes of microbiome dysbiosis. That and just not having routine frequent cleanings. Teeth are the only non-shedding surfaces in the body. So, we have our skin microbiome, but our skin completely sheds off, every couple of weeks. Our gut even turns over. I think it's every 7 days or something like that. Our gut turns over, but our teeth never turn over. They don't shed at all. And so, unless you're going in and mechanically cleaning the biofilm off the teeth, you can get a dysbiosis very, very quickly.
Yeah. Yeah, crazy. I never thought about that, that everything else sheds, but your teeth
Everything
don't.
sheds, but your teeth don't. And so a lot of people will say, I haven't had a cleaning in, 2+ years, 5 years, 10 years. I mean, think about, and the longer that biofilm stays on the teeth, the more complex it becomes, the more microbes attached to it, and the stronger the attachment is to the teeth. So the more frequently you can get in with your own toothbrush and the more frequently you can get in to see a dentist or a hygienist to mechanically remove it, the less complex and the less strong the microbiome buildup will be.
I definitely up my flossing game after reading your
Good.
book. I was
Oh,
doing
good.
it like several times a week, but yeah, it was real motivation to
Yeah.
just take things a little bit more seriously.
Yeah. A lot of people don't like to floss, right? Flossing kind of has this negative connotation and it can be a bit tedious. But if you think about it, I mentioned earlier that the gum tissue is what houses the bloodstream. That's why gums bleed. And we have gum tissue in between our teeth, right? We have the pointy papillas that go in between our teeth. The only way to clean the surfaces of the teeth that are right next to the gum tissue is by flossing. When you're brushing alone, you're only brushing 3 out of the 5 surfaces of your teeth, and you're missing the 2 most important surfaces, which are the ones right next to the gum tissue. So I tell people all the time, if you have to choose between brushing and flossing, floss. We should be flossing at least twice a day.
And what do you think about tongue scraping? This is something that I started a while ago, and I just find it so addictive. So
So addictive.
strangely, yeah, it's a weird thing, but I just love it, and
I
I can't go a day without it.
I
What's your
think if
take?
I think if you could see uh the effect of flossing like you can see the effect of tongue scraping, I think more people would floss, right? Like when you scrape your tongue, you can see that you are getting stuff off of there. And I think that's why it's so addicting. But I actually love tongue scraping. um our tongue, the microbiome is different depending on where it is in the mouth. And so the tongue has its own kind of microbiome. And obviously, if someone's suffering from bad breath or maybe their food is tasting a little funny, we get a lot of yeast buildup on our tongue also. And so it's really good to use an instrument specific for that microbiome to clean it. When I was growing up, I was raised by brush your teeth and then brush your tongue at the end. But then we're just really translocating bacteria, which we shouldn't really be doing. So getting a tongue scraper is more effective and healthier to do.
And you mentioned that if we're surrounded by people who don't have the healthiest oral microbiome, that can impact ours. What do we do about that? Like, can we strengthen our own so we have a really strong immune system and a really healthy microbiome so we're less impacted by them? Or do we have to just ensure that those around us have healthy microbiomes as well?
So I would say probably a little bit of both, right? So if you live in a home and you have a husband and kids or whatever your family dynamic looks like, I think it's definitely key to make sure that everyone in your family has been tested and cleaned up or checked by a dentist. And then once you get rid of all the bad pathogens in your mouth, you hit it right on the head. It is so critical to build up your own oral microbiome because that is your defense system. It's your defense system against getting sick, your defense system against picking up bad microbes from other people, but then your own defense system from own bad pathogens in your mouth from kind of taking over. So the bad bacteria in our mouth make up less than 1% of the microbiome if you have a healthy microbiome. Now, when that gets out of whack because your oral microbiome isn't strong and robust, that scale will definitely tip. But yes, supporting your own microbiome is definitely key for overall health.
And in your book, Say by the Mouth, you talked about specific bacteria that can be in our mouth that lead to health concerns if left unchecked. Can you tell us about those specifically? Like, how many are there? Were there about 5 that we really have to take seriously?
Yeah, so I test for about 11 in my
11. Okay.
practice. And there's, depending on the condition that we're talking about, there's about 5 that cause a lot of issues. Um, and yeah, I'd probably say 3 to 5 that we tend to focus on in terms of whatever ailment we're treating, whether it's heart disease, diabetes, cancer, fertility, Alzheimer's, dementia. There's a lot of overlap between the pathogens. It just depends on where they take up residence in the rest of the body and what kind of damage they're causing.
Okay. And how do we know if we have one of these 5 or these 11? Like,
Yeah.
what
The
do we
good thing
do?
is that now we have testing. So, everyone has been doing stool testing, gut testing. You could do a biome, saliva test to see what's in your mouth. Bristle also has a great test out there that's direct to consumer. So it's really critically important to test your oral microbiome because you don't know what's there unless you test. And every day I have patients come into my practice that think that they're healthy. They have no signs of bleeding gums. They have no signs of bad breath. Sometimes they have cavities, sometimes not. But then we test their oral microbiome and we find out that there's all kinds of dysbiosis going on. And if we wouldn't have tested, we wouldn't have known. And the critical thing about disease process is that most people will have underlying inflammation, or the disease process will be going on for about 10 years before they actually qualify for a medical diagnosis. And so just because you don't have symptoms doesn't mean that something is not wrong. It just means that it's not to a level yet to where it's causing systemic damage, but critically important to test. And now you can get these tests over the counter if your dentist doesn't provide them.
Okay, so you can go in, like when you say over the counter, where do you get those? Is it from
Yeah,
pharmacies?
yeah, no. So Bristle, Bristle. So Bristle has a direct to consumer saliva test that you can order from their website. Viome also has a saliva test that you can order. And then there are biological dentists that do salivary microbiome testing. So you can look up to see if there's a biological dentist in your area. Now, the tricky thing is that just because you're a biological dentist doesn't mean you do microbiome testing. A lot of times biological dentists remove mercury fillings or do some ozone treatment, but they may not be into salivary testing. So really critical that you call and ask ahead to see if they do it. And then there's people like myself that will do telehealth remote visits for patients. And so I actually have a lot of patients from Canada that we'll do saliva testing with. So I can ship them kits to their house. They can take a test, and then we'll review the findings, and we'll create a care plan for the patient. And I'll work with their current healthcare provider to get that treatment rendered. But our care plans need to involve not only dental treatment, but also nutrition and supplements and lifestyle coaching as well, because it's all integrated. As you know, you can't fix one thing without kind of trying to fix it all.
Yeah, that makes a lot of sense. So I will put it in the show notes, but for people who are just listening, can you tell us the website that they can go to order those tests through you?
Yeah, so they can get it on my personal website. It's katieleedds.com. So dentist, surgeon, my credentials, katieleedds.com.
Okay,
They
that's
can just
amazing that you
they
provide
can
that service.
yeah, they can just order it right there. It ships to their house. You spit in the tube and then you ship it back in. And then me and the patient meet and go over everything. I do a lot of salivary testing for fertility patients because oral health, fertility and gut, and actually diabetes, but main patients that I work with are people that are trying to have babies because fertility is very closely connected with the oral microbiome.
Yeah, that's an interesting point. And the first time I came across you was actually listening to a podcast that's all about fertility. And I found that a fascinating connection that I don't think a lot of people put together. But it does make so much sense because fertility is a sign of optimal health, and you need to have a great oral microbiome to have optimal health.
Yeah. I just actually, before I got on this podcast, I was talking with a group of OBGYNs, because the disconnect between the mouth and how it affects fertility is there between dentists and doctors. But there's a really big component to oral health when it comes to fertility. We have bacteria in the mouth that decrease fertility in men and women. There was actually a study that came out in 2025 talking about the oral microbiome and how it affects male infertility, which I was so excited about because I've been screaming this from the rooftops for years. And so it's really cool to see that study come out. But we also see a lot of oral bacteria as it relates to endometriosis, to PCOS. And then another big thing that people don't realize that affects fertility is actually our airway. So a lot of people will have airway issues such as sleep apnea or snoring. And if you're pregnant and you have an airway issue, that could definitely lead to underdevelopment of the baby, preterm birth and low birth weight babies. So there's a lot of dentistry here that can definitely impact systemic outcomes.
Yeah, it's really nice to see like the work that you're doing and more dentists moving in this direction of not just focusing on the teeth and
Yeah.
connecting it to the whole body because everything's connected. I don't know why for so long we had our teeth health so separate from everything else.
I just did a lecture on this and it is totally the dentist's fault. So I was in a room of like 300 dentists giving this lecture and I thought they were all going to start shooting arrows at me, but I blamed our own profession because we actually were integrated with medicine. Aristotle and Hippocrates even have sayings about the oral microbiome and the bacteria in the mouth and how it relates to systemic health. So they knew back then in ancient times that it's connected. And then I think dentists started getting more and more and more specialized. And then, we started allowing barbers to do fillings in people's teeth. So you could go get your hair cut, get an amalgam filling, get your tooth extracted all at your barber. And then we officially broke off from medicine in the 1800s and founded our own dental school at the University of Baltimore. So it's totally our fault. We took ourselves out of medicine, and now we're trying to get back integrated with them.
Yeah, it's a good step. It's a really good step.
Yeah.
So, what can we do to help make our oral microbiomes healthier and help our kids to have oral microbiomes that are robust? Like, I imagine testing obviously is a really key part of that, but are there steps that we can take even before we do testing or whether we do it or not to just like
Yeah.
bolster that health?
Yeah, so let me break it up into, let me first say why testing is so important. So, you can get tests over the counter now, which is amazing. And then the reason why it's important is because the bacteria are all treated differently. And so in dentistry, we've always done the same type of treatment if someone has gum infection. And what we've seen over time is that gum disease is actually on the rise by 34% globally. Gum disease is actually in the top 10 of all diseases worldwide. So we are not doing a good job as a profession mitigating this disease. And now that we know that it's connected to so many other systemic diseases, we really need to start trying to be more effective in our approaches. And when you look at a microbiome test, half of the pathogens that cause issues aren't responsive to cleaning. So if you're just doing a cleaning for a patient, it's no wonder every time they come back and they say my gums are bleeding and they've always bled. It's because we're doing the wrong treatment. So that's why testing is so important. You can also test to see what good bacteria you have and what you don't have. And then there's different things that you can do to either add those bacteria back in or supplement their growth. So what I'm talking about is, let's say that you have a microbiome that's low in bacteria that produce nitric oxide. Nitric oxide is a really important and potent vasodilator that we need in our blood vessels to dilate our blood vessels, improve blood flow, improve healing, reduce inflammation. And a lot of the microbes in the mouth are responsible for a large majority of the nitric oxide in the body. So if you don't have those microbes, you can put those microbes in, and or you can supplement them with things like beets or fruits and vegetables that actually promote nitric oxide production. So I usually will supplement with oral bacteria to boost that, and then I'll also tell the patient to supplement with beet supplements or go eat a lot of beets to help boost nitric oxide until those bacteria can build up. So it's important to test so that way you know what to put in. There's a lot of really good oral probiotics that you can take that are on the market. So depending on the strains that you need to supplement with, you can actually supplement with those strains. But the two best things that I always tell people to do, if you're looking to boost your oral microbiome, eating a plant-based diet is great for your oral microbiome. The fiber, those are prebiotics that the oral bacteria love. If you're trying to reduce decay and trying to get rid of the bacteria that cause tooth decay, an animal-based diet is going to be great for that. But then there's two supplements that I absolutely love from a doctor. Her name is Dr. Emily Stein. She founded a company called Daily Dental Cares. I think the parent company is Primal Health, but she created these two products that essentially make the mouth a ketogenic environment. And remember earlier, I mentioned that bad microbes love sugar. So when you make the mouth a ketogenic environment, the bad microbes can't survive and then the good ones flourish. So I put all my patients on Fossident, which is an anti-cavity lozenge. It's a mint that you can suck on throughout the day. People love mints anyway. And then the other one is Protectin. Protectin is really great to prevent the gum disease type of bacteria. And she also has that formulation in a water additive, so you can drink it and it's great for the gut. And then you can also use her Protectin lozenge inserted vaginally if you have issues with recurrent yeast infections. So those two products have been really, really great.
Yeah, it's exciting to see all the different oral probiotic products coming out. And I've never
Yeah,
heard about creating that ketogenic environment in the mouth, but that makes so much sense because it is challenging to deal with yeast overgrowth.
yeah,
That's a
yeah,
big challenge.
really big challenge. And so I would say, to answer your question, what can you do? Test to see what's there. Lots of high fiber, so lots of vegetables. Um, And then pro and prebiotic supplements, I think, are going to be the great thing. And then, of course, we got to brush and floss minimum twice a day, and tongue scrape. And then the other key thing is like the products that people are using. So a lot of times people, I grew up using Scope and Listerine mouthwash, right? And we would buy the concentrated versions, and we would always mix it stronger than what it recommended because we thought the more it burns, the cleaner you are, right? The fresher you feel. And what we now know is that is horrendously bad for your oral microbiome. So you want to make sure you're using very gentle, chemical-free products. Don't destroy the microbiome. That's not good because you're wiping out the good and the bad.
Are there any mouthwashes that you recommend? Like, are there some really good ones that have probiotics in them or are gentle on the microbiome?
Yeah, so there's really, when I wrote my book, it was very difficult to find good products. Now they're almost everywhere, which I love. Mouthwash is not going to, there's really no health benefits to mouthwash. You could do oil pulling or something like that, but to be an effective oil puller, you really need to swish the coconut oil for about 20 minutes for it to be effective, which most people, I can't get them to floss for 2 minutes. So I'm like, I'd rather you floss than pull for 20 minutes. So mouthwash is really just going to be to rinse out any remaining kind of plaque and bacteria that are there, and to help freshen the breath. But you don't really need a mouthwash is what I'm trying to say. It doesn't really do a whole lot for your health, but Risewell is a really great brand. Biocidin is great. Boca is really good. Feed Your Good Guys is really good. Revitin toothpaste, I really love. It's full of vitamins and minerals and prebiotics. So there's a lot of really great ones on the market
Yeah, that's exciting to see that there are so many options.
everywhere. Tom's is a very common brand that you can get at any health food store. Tom's is actually a really great brand. You can get Tom stuff. TheraBreath, that's dentist formulated. That's really good. Tooth and Gum Tonic, that's another one.
Yeah,
There's a
there's
lot
a
out there.
lot.
Yeah.
And you were saying that a lot of the time, signs of having not the best oral health, like, don't really show until down the track, like 10 years down the track, they turn into diseases.
Yes.
What about for our kids? Like, are there any signs that we can look for to see if there are issues there? Because, they're young. They probably haven't even been alive for 10 years.
Yeah. So there are actually some signs that will start to show if the microbiome is off. Especially like in kids too. Kids, there's a lot of other telltale signs, but in general, if anyone has bleeding gums, I mean, that's going to be a sign that something is off. Sensitive teeth oftentimes is a sign of either bone and gum loss, which could be gum disease, or nutrient deficiency like magnesium. A lot of people get sensitive teeth from that. Um, if someone has a lot of mouth odor, that could be, or that is a sign of dysbiosis. And cavities. So we should not be getting cavities. Cavities are caused by a couple different specific bacteria. You have to have the bacteria, they have to have the food source, so carbohydrate, and then you have to have a pH imbalance where the pH dips very acidic in the mouth for the teeth to dissolve. So those three things need to happen in order to get a cavity. So if someone's getting cavities, they could have a bacteria problem, a substrate problem, or a pH problem, but it's typically it's usually all three, but your good microbes should be able to keep those cavity causing bacteria at bay. So if someone's getting a lot of cavities, we got to look into that. Also look into their nutrients as well. Oftentimes they're going to be very depleted in minerals. So that's big. And then for kids, cavities are going to be big, looking at their gums if their gums are bleeding. But then a big thing with children that a lot of people don't realize is airway. So we're seeing a lot of kids with airway issues, and the airway issues are leading to crowding of teeth. They're leading to the bite, their occlusion not being correct, sleep issues, chronic, ear infections and sinus infections and throat infections, ADHD, poor sleep. We're seeing all that, and it's typically airway for kids.
Yeah, that's something that I'm delving into with myself and my 8-year-old son. We're working on getting him to stop mouth breathing and opening up his palate
Yes.
and doing so
Yeah.
many things. So, cavities, are they associated with mouth breathing too? Because that creates a
They,
different pH, is that right?
Yes. So when you breathe through your mouth, specifically at night, our saliva in our mouth is very protective of our teeth. So if our teeth are coated with slippery saliva, it makes it very difficult for cavity causing bacteria or gum disease causing bacteria to attach to the teeth. So when the teeth dry out, it gives a perfect environment for cavity causing bacteria to attach to the teeth and start causing decay. It also reduces nitric oxide production and makes the mouth more acidic. So, yes, you're right there. So, we'll see a lot of cavities, especially cavities on front teeth in kids that mouth breathe. We're born nasal breathers, right? If you ever look at a baby, they're a nasal breather. We develop into mouth breathers. So, it's critical to keep our kids breathing through their noses.
And is that something that you work on in your practice?
So I have providers in my office that do that for kids. So I have a myofunctional therapist that they are pretty much, she doesn't like when I say this, but I feel like it's the easiest to understand. They're like physical therapists for the mouth. So she's a dentist, but she specializes in myofunctional therapy. So she, helps parents and kids learn to do exercises to strengthen the muscles outside and inside the mouth to promote nasal breathing. And then we work with an orthodontist that does expansion and orthotherapy for our kiddos to get them developing properly and breathing properly.
And up to what age do you see that that is beneficial to do the myofunctional therapy as well as the expansion? Is there like a limit to that?
No, no. So any for adults, for example, any adult in my practice that has sleep apnea, I also send them to the myofunctional therapist. Because if you tone your soft palate, learn how to swallow properly, tone your tongue, it definitely reduces a lot of the symptoms of sleep apnea in conjunction with sleep apnea treatment, of course. But no, I mean, I have 80-year-olds doing myofunctional therapy.
Yeah, that's so awesome. I
Yeah.
guess it's like going to the gym or like you say, like
It's like
physiotherapy
going to
for.
the gym, and as we age we lose muscle, right? We lose muscle, we lose our strength, and so we got to tone it all back up. Yeah,
Mhm.
absolutely.
Yeah. Yeah. It's something we don't think about. We think about that with our biceps, let's say, or glutes, but not
Yeah,
necessarily our tongue.
yeah,
And how can moms start building a optimal microbiome in their children's mouth, like right from the get-go?
yeah. So when we're born, we're pretty much sterile. The first microbiome that we get is through the vaginal canal, which is why vaginal births are so critical. After that, it's by the breast with breastfeeding. Now, not I had a surrogate baby, so he was born vaginally, which was really great. But a lot of babies are born C-section, so they're going to get introduced to the microbiome through the environment. So always making sure, again, whatever we have, we're going to transfer to our kids. I'm constantly kissing my son all the time, always kissing him because he's so darn cute. So I have to make sure my microbiome is going to be good in order for his microbiome to be good. Unfortunately, our food sources these days are not the best when it comes to vitamins and minerals and nutrients. So I like to give my kiddo minerals in his water. So you can actually buy trace minerals online and just put a drop or two in their water to supplement them. I also give my kiddo probiotics in his water, and then I give him the little mints too. He is obsessed with the Daily Dental Care's lozenges. I grew up with a ton of cavities, and so I just want to make sure that doesn't happen with my baby. And then I, for one, have a very picky eater. Which I know stems from me. And so in order to get him to eat the things that he needs to, we do a lot of smoothies in our house. So he'll crush anything that has fruit in it. So we like to hide all of the yummy probiotic yogurts and spinach and vegetables. We'll hide those in smoothies just to make sure that we're supplementing him well. I'm sure there's lots of things I'm doing incorrectly. As a mom, we always worry about that, but we do our best. And then we brush his teeth twice a day, the best we can. Brushing a toddler's teeth is really hard, but I think if you just do a few small things and do them consistently, you're going to be way ahead of the curve.
Yeah, absolutely. And I totally agree with the smoothies. I even take it one step further. And when I have the extra little bit at the end of the smoothie, I pour that into little popsicle holders. And then,
Smart.
oh, like if you think kids like smoothies, they love
So he
popsicles.
loves popsicles, and I have like these organic fruit. They're just fruit popsicles, but I buy them. I should just, yeah, make them at home instead of spending all the money. I mean, I will definitely say the food manufacturers definitely get me on all the convenience foods because I'm like, oh, I'll just get that instead of
Yeah.
making my own. But it's always better to make it yourself.
Yeah, and there are some really good options out there because we do live really busy lives that we can't be doing it all.
Yeah, yeah.
I work a lot with parents to support picky eaters. Is there anything else that you do that you're doing to like foster healthy eating in your child and having him be an adventurous eater?
I could use this advice from you. We worked with a childhood nutritionist to help us. Some things that she suggested. I read the book like Avoid the Mealtime Meltdowns. That was really helpful. We also got like the construction plate with the forks that turn into forks and spoons that are construction trucks so he can push his food around. She also had us get picks, like toothpicks, but for kids that have animals on the end. So he'll get to like kind of stab at his food with the toothpicks. And then we try and do one food we know for sure he will eat on his plate, one he sometimes eats, and then one that we're trying. Um, and we try and sit with him and eat. But yeah, having such busy lives, like it's tough to do. And he goes in phases where like at one point he only wants to eat bananas and like nothing else. And then other times he only wants to eat blueberries and nothing else. And then other times he wants to eat rice. And I'm like, we got to get some more stuff in, but we try to not make a big deal of it, because I don't want to make food a stressful thing for him. So we try and just supplement what we can with the smoothies. And he's growing. So I'm happy. I try not to worry about it too much.
Yeah, I think what you're doing is that those are all amazing things that you're doing. And having that smoothie there is just like that reassurance of, okay, I'm getting
Yeah.
that in, and everything on top of it is bonus that he's
Bonus.
trying. He's at the table with you.
Yeah. Thank you.
Amazing.
I worry. The mealtime stuff is, we talk about it every day, trying to get him to eat stuff. So thanks.
Was there anything here that I didn't ask that you really think is important for parents to know about dental health and oral microbiome for themselves and their kids?
I think what's really important is to realize that most dentists, and I think, and this is probably not going to go over well with the dental audience, but um, even less pediatric dentists and less orthodontists actually know about a lot of the stuff that I'm talking about today. Um, I'm seeing more and more general dentists picking up on this stuff, but seeing less and less pediatric dentists and orthodontists picking up on airway and microbiome issues, and especially when it comes to cavities and airway. So if you think something is not going well with your kid, or if they have any of these issues, keep searching for providers until you find someone that actually does a test. Don't just settle for your current pediatric dentist or orthodontist saying, oh, your kid's fine, like they'll grow out of it. That's not a thing. If your kid is severely grinding their teeth at night, that's an airway issue. If they have ADHD, get them checked for airway. And if they have lots of cavities, that's a microbiome imbalance and a nutrient deficiency. So go and try and, keep searching. Don't just take what your current provider says at face value, which again, I'm sure that's not going to be popular opinion that I just said that, but I think it's important to note.
Yeah, it absolutely is. And some people might live in places where they don't have access where they are to somebody who is a bit more holistic. But I love that people like you are providing that telehealth option that maybe they can go to cleanings at their local place, but then they can work with you on those more deeper level issues.
There is a really good, I'm looking at my phone, I apologize, but Dr. Stacy, she is a holistic pediatric dentist. She was actually on Huberman's podcast for oral systemic health. Like I was like, heck yes, this is awesome. Um, I, I've never met her, but she is a wealth of knowledge, and she does telehealth consults for patients or for parents also for their kiddos. So Dr. Stacy is her name.
Okay, that's a great resource. I'll add that to the show notes as well. Thank you.
Yeah.
Well, thank you so much for coming on here and providing so much information. And I love the passion that you have for what you're doing because it is so important. And please
Thank
keep
you.
spreading that message and making this become the norm in dental health.
Thank you. I'm going to try. And her name is Dr. Doctor _ Stacy, Staci.
Okay.
and you can go on her Instagram. I've never met her again, but I just follow her. She's awesome. And she'll do a telehealth for parents and their kiddos.
Do you do telehealth for kids as well?
I do, but I'm not a pediatric dentist. I'm a general dentist. I know a lot about pediatric dentistry. I see a lot of kids that I just had a mom move her kiddos over to me because they had lots of cavities. She noticed they were snoring. And so we're getting her kids treated, but I'm not a board certified pediatric dentist.
Okay. Well, thank you so, so much. I really
You're
appreciate
welcome.
this.
Thanks for having me.